This is a recognizable objection to many. Hands and feet shiver, now and again consuming. Yet, it's anything but a sickness, however a side effect of some illness. By and large, when the fringe nerves are harmed, different tactile issues happen. Toward the start of the infection, the legs shiver or consume, steadily the sensation diminishes. Some say it seems like an electric shock or like a pin prick or strolling insects. In some cases, the smallest touch gives an alternate inclination. At the point when fringe nerves are harmed, they send rehashed torment messages to the mind. Thus, regardless of whether there is no injury, disturbance, or agony is felt. Some couldn't keep garments on their feet. Feet ought to be kept dry while dozing around evening time. These causes upset rest, which further confuses the issue. Feet are to a greater extent an issue as opposed to hands. Such sentiments start from the bottoms of the feet and slowly rise upwards. Assuming the issue is more, the sensation of the feet is many times decreased, the patient doesn't feel regardless of whether the shoe tumbles off the foot or gets harmed. Such quiet wounds can prompt ulceration and later gangrene. What is the explanation? Fringe neuropathy can be brought about by many reasons. One reason is diabetes. 60 to 70% of diabetic patients might be impacted by this difficulty because of high glucose levels and uncontrolled diabetes. Aside from this, absence of vitamin B parts like thiamine, B1, pyridoxine, B6, cyanocobalamin, B12, nicotinic corrosive and riboflavin causes disturbance and agony in the feet. Metabolic and hormonal issues like hypothyroidism, joint inflammation like rheumatoid joint pain, malignant growth, HELPS can cause this issue. This issue likewise happens in kidney disappointment, hemodialysis patients and liver issues. Here and there chemotherapy or consuming specific medications like tuberculosis drugs, long-haul gastric medications and a few different medications can cause consuming feet. Exorbitant drinking or smoking, weighty metal contamination and a few different reasons can harm nerves. Sensitivities, utilizing garments and socks and wearing broken shoes can likewise cause this issue. This issue can happen assuming the nerves in the leg are harmed, obstructed, entanglement, or compacted, pressure. Aside from this, individuals experiencing mental issues or hereditary problems likewise frequently cause consuming feet. Estrogen lack can likewise cause acid reflux after menopause in ladies. In the determination of fringe neuropathy, an exhaustive actual assessment ought to be finished alongside the patient's past history. Diabetes, thyroid chemicals and nerve conduction tests should be possible if essential. What to do? If necessary to forestall sickness, a few extraordinary nutrients ought to be taken. Nutrient infusion ought to be moved for illnesses brought about by B12 lack. Diabetes ought to be monitored. Abstain from drinking and smoking. A specialist should be counseled in the event that the nerve is harmed, impeded or compacted. Open and agreeable shoes and socks of right size ought to be worn. Utilizing foot curb backing, insoles and impact point cushions will enormously decrease side effects. Leg muscle activities in cold water, not ice, splashes can be taken. It ought to be noted whether the patient has fringe neuropathy because of taking any prescription. Tingling sensation is awkward yet can be restored on the off chance that the reason is analyzed and treated appropriately. Counsel an expert specialist if necessary.